This one, okay. Good morning. I'm Yu Hu from Wuhan Union Hospital, Huazhong University of Science and Technology, China. This is the first time I attended the press conference. I feel very honored to have a chance to make a presentation about bispecific CAR T-cell therapy targeting Bcma and CD38 for hard-to-treat multiple myeloma. I will show you the updated results from phase 1 dose climbing trial. CAR T-cell has shown the promising results in leukemia and lymphoma. However, in multiple myeloma, it's still being explored. Most of the CAR T-cell in multiple myeloma target Bcma. The question is, most of the patients short-term relapsed. That's the main problem. So to solve this problem, we design a bispecific targets CAR T-cell that's just containing the Bcma and CD38 in tandem. So we can see from this figure that these CAR T products combined the Bcma and the CD38 antigen on the membrane of the plasma cell, both simultaneously and individually. And I think this kind of new CAR T cell may have some effect on the suppressor B cell. That means it can overcome the immunosuppressor of tumor environment. All patients in this group are subjects to lymphodepleting by cyclophosphamide and fludarabine. And the CAR T infused with different dose from 0.5 to 4 times 10 to 6. 22 patients enrolled in this group, and up to the cutoff dates, that means October 31st, 19 patients still alive, and 10 keep the SCR, 1 keep the VGPR, and 4 keep the PR, 3 patients relapsed. These the patients, the baseline characteristics. The patients with a median age is 59 years old, and 78% has different cytogenetic abnormality, such as 1q21 application. 9 of the patients has developed extramedullary diseases. 19% observed CRS, but severe CRS is just account for 22%. No neurotoxicity was observed. Almost all the patients was observed with hematological toxicity. 13% of the patients was observed with hypotoxicity and 1 with nephrotoxicity. This slide shows the clinical efficacy of the Bcma CD38 CAR T-cell infusion. The reasonable dose is 4 times 10 to 6. At this dose, we get the OPR is 90%, includes 12 SCR, 2 VGPR, and 5 PR. 18 patients reached the MRD negative states. The median duration of progression-free survival has not been reached. Interestingly, we found that the peak time of the CAR T-cell in peripheral blood is 7 to 5th day after infusing for SCR patients, while for non-SCR patients is 14 to 30 days. This CAR T-cell can be tested by Q-time PCR in peripheral blood of all patients, and the longest duration is more than 450 days. 8 of the 9 patients achieved the partial or complete eliminated of the extramedullary tumor. This shows some of the cases. This is patient 7. It's a 60-year-old female with periodic lesion. After CAR-T refusing, the huge mass becomes small, and this patient gets a VGPR in the 2nd month. Another patient is a male with a parathoracic huge mass, and after CAR-T infusing, the mass disappeared. And the 3rd patient is a huge mass in the breast, and after the CAR-T therapy, it becomes small. So we can draw the conclusion. This is the first clinical trial about anti-Bcma and CD38 dual-targeted CAR-T cell therapy for relapsed or refractory multiple myeloma. Our study demonstrates improved efficacy and manageable safety with this CAR-T cell. The Bcma and CD38 CAR-T cell have a higher ORR, especially a higher rates and a long duration of SCR, and the effective elimination for extramedullary lesions. This initial data provides the strong evidence to support the further development of dual-targeted CAR-T cell therapy for hard-to-treat multiple myeloma. I would like to thank Chenggong Li Therapeutics. Thank you for listening.